Next, we will be discussing the post-op diets and how to eat after surgery for optimal healing and recovery.
Okay, so then we're moving on to after the surgery. So this is when you've gone home from the hospital and you're resting at home. Your post-op diets are designed to give you the protein and the nutrition that you are going to need to help your body heal. It also helps to gradually introduce you to new foods, textures, and slowly increase your portion sizes so that you can get to a point where you're eating still small meals, but something that is more appropriate long term for someone who's had surgery. Please do not advance your diet before it's recommended. These diets have been formulated so that you are able to maximize your weight loss, but also so that you don't injure yourself by eating something that is going to make you feel sick. We're not going to do any raw fruits or vegetables for the first 3 months post-op. Again, too much fiber and it's too crunchy at this point for your stomach. And then we're not going to do any starchy foods like breads, pastas, crackers, rice, any of those types of things before 6 months post-op. So we're going to get started with diet stage 1. The first 2 days that you're home from the hospital, you're not going to be eating anything solid. You're just going to drink your protein shakes and drink your fluids. Once you can get through 2 days of hitting 60 to 70 grams of protein and 64 ounces of fluids or more, then you can move on to diet stage 1, which is your blended smooth foods. Everything should be very smooth, no chunks, no lumps, strings, or solid pieces. You're going to be focusing on things like cottage cheese, Greek yogurt, protein shakes, pureed beans, and other foods that you will see listed on the food list. With things like cream of wheat or oatmeal, those are great things to add in, but they don't have a lot of protein. So you want to maybe add some protein powder once it's prepared. Again, everything that's going in your mouth should be high protein. For diet stage 2, you're going to move into foods that are a little bit more solid. So this is going to be from weeks 3 through week 6. You're still hitting 60 to 70 grams of protein and 64 ounces of fluids. But you can start adding in things like tuna or tuna salad with a little bit of light mayonnaise. You can do poached eggs or soft boiled eggs. Again, you can do beans, canned chicken or canned fish or tuna, lean ground meat like ground turkey or ground chicken. You're looking for 93% lean or higher in terms of the ground meats that you're looking for. You could also certainly do deli turkey, low sodium deli ham, and then also you can do soft cooked vegetables. So at this point, you want to make sure that all of your vegetables are very well cooked. You want to be able to mush it with a fork. So you want it to be soft enough that you can really chew it up thoroughly. Because again, we're not doing any raw fruits or vegetables for the first 3 months. And then for diet stage 3, it's pretty similar to stage 2, but you have a little bit more variety with your protein sources. So you can now advance your diet to shellfish, you can do lean ground beef, you can do lean moist meats like even a lean steak. The big thing here is that you want everything to be nice and moist. Everything should be cooked in a way that's going to retain moisture, like poaching or baking, braising, making things in the crock pot or using your Instant Pot or something along those lines. We want to make sure that we're keeping that moisture in there. Even if you have something that you've prepared that maybe was a little overcooked or a little dry, you can always add a little bit of warmed chicken broth. Some people like to take their meat or their chicken and they'll dip it in the chicken broth. Certainly things like fat-free or low-fat gravy can be a great option. Even some pureed tomato sauce, as long as it doesn't cause any acid reflux, but something like that could be really good poured over some ground beef to make a little bit of a soft tomato sauce, or like a meat sauce. You could certainly do a little bit of tomato over chicken. Something like even a little bit of hummus might be good to kind of help moisten up some of your meats. So just keeping that in mind as you are thinking about foods that you're going to start introducing. Again, we're not doing any raw fruits or vegetables until you get to 12 weeks post-op. And at this point, you should not be doing any breads, crackers, rice, um, any starchy foods, because we're going to wait until 6 months post-op to do those. So now let's talk about the menu assignment. For every person in the class today, we're going to want you to fill out examples of what you would eat if you were on these post-op diets. So what you're going to find is blank menus in your book, and these are going to be where you're going to create a meal plan for yourself as if you are on stage 1, stage 2, and stage 3. So this is a great example of how you would fill out your menu on stage 1. You can see that they're incorporating stage 1 foods like Greek yogurt and cottage cheese, and that they're also writing them in the appropriate portion size. You can see that there's protein shakes that they're using throughout the day, and also that they're getting in enough of their fluids. We also would like you to write down when you're going to take your vitamins. So if you remember from the vitamins discussion, you're going to want to take your multi and your B50 complex together, and then you're going to want to do your calcium later in the day, and you also want to take your calcium in separate doses. So some people might choose to take them to take their multivitamin and their B complex at night, or some people might want to do it in the morning. It's however you like, but we just want you to start thinking about that and to write it down. Once you've finished your menu assignments, which you can either complete in the PDF forms that you'll be able to access on the Thinkific site, or if you want to do it physically in your book, either way is fine, but your dietitian is going to want to go over that with you. So you can either access your blank menu pages on the Thinkific site, or you can access blank menu pages in your book. You can find them in your book on page 29. So now it's time to complete your learning module quiz. Make sure you go in and you complete the quiz. Your dietitian will check to see if that's been completed. And if you have any questions at all, please reach out and get a hold of one of the dietitians here. Thanks, and hope you have a good day.